Ladies and gentlemen, we have come to know today that India has reported its first Omicron variant cases of COVID. There is a lot of global alarm about this variant, and there are a lot of questions as well. And we are joined today by a person who can answer many of the questions specifically about the origin and provenance of this variant. Dr. Angelique Coetzee joins us today from South Africa. She is in fact the South African doctor who raised the alarm over the Omicron variant. She is also the head of the South African Medical Association. Dr. Coetzee, I thank you so much for joining us and for speaking to us on Republic. My first question to you is, how did you come by this variant? What caused your own internal alarm to be raised? And what did you see that made you think that this could be something different?
Good afternoon from South Africa. Yeah, very good question. Remember, we haven't seen between 8 to 10 weeks any new COVID-19 cases. We were out of our third wave. And so when that specific morning on the 18th, when that patient came and presented to me with symptoms suggestive of upper respiratory tract infection or a viral infection, it didn't make sense for him to say he's extremely tired, and he actually thought that it was because he was working very hard in the sun the previous 2 days. It didn't make sense, so I tested him and then found to my shock that he's positive. So his family also had made an appointment for that same day. We tested them and the whole family positive, and thereafter I saw more patients. All of the rest that came in all have the same type of symptoms. Yes, it is a COVID-related symptoms because it is, body aches and pains, headache, chronic or a fatigue that is there for a day or two. Then some will say to you, I've got a bit of a scratchy throat. Some will say to you, I've got a slight cough. Nothing spectacular. No one really complaining of fever as a symptom driving them to the doctors. And this didn't fit in with the Delta variant. Remember, we have seen a lot of Delta variant cases. They don't really present like that in the beginning. And so that I raised the alarm with the advisory committee on vaccines, and simultaneously in the background, our one of the labs saw that the PCR testing, the S gene, there was a fallout on the PCR test, and it will test negative, and that didn't make sense. He also raised alarm. And our scientists then look at this, and 4 days later, 4 or 5 days later, they said to us there's a new variant, and that's how we saw the new variant.
All right, so you noticed that it had different symptoms from the prevailing Delta variant, and they were so different, in fact, that you decided to, I presume, send it in for genomic sequencing, and that's when 4 days later you found out? And if that is the case, what was your reaction then? What did you choose to do differently, or did you choose to flag it to any other agency, doctor?
So interesting enough, they were already from other doctors testing the genome sampling or PCR sampling, and saw that this was different. So so I did a rapid test. So this is interesting. It doesn't escape the rapid test. Rapid tests, if you do it within after 24 hours until about 5 days since symptoms starts, it can pick it up. It is sufficient to pick it up. And you can then do if you want to know whether it's Omicron, if you can't distinguish with the symptoms whether it's Omicron or Delta, then you do the PCR. If the PCR is showing the S gene fallout, then you know it's Omicron. But you can go also on clinical symptoms, because not each and every one can do a PCR test. It's quite expensive in our country. So clinically, you need to understand what the symptoms are. And if you're then not sure, you can follow it up with a PCR test. But the symptoms are much milder than with Delta. It's not the same.
That's very interesting. If you don't mind, because I think this has not been covered so much, could you run us through the symptoms that one feels or exhibits when they have the Omicron variant once again versus when they have the Delta variant?
Okay. So the biggest difference between the two is Delta will give you loss of smell, loss of taste in most of the cases, with a very blocked and stuffy nose. They will come in with a fever. They will, or not will, the majority of cases will have a fever. They will have an elevated pulse rate, and they will have a lower, still normal, but lower than normal oxygen levels. Whereas in this case, oxygen level stays normal, very, very slight increase in pulse rate, if any, and no loss of smell, nothing like that. Only this scratchy sort of throat, generally not feeling well for a day or two before they come to you. And then within 2 to 3 days after you started or after they visit you, they get well. Whether, this is self-limiting in the end, we don't know. But at this stage, what we do know, even if you are vaccinated and you get a breakthrough infection, it's still mild. My oldest patient with breakthrough infection is 82 years of age. And this lady had her last jab in July, Pfizer, and she's fine. She's doing excellent.
All right. So the symptoms are different, but you're saying that they're also mild. But one of the things that has a lot of people concerned is whether or not the Omicron variant is more transmissible. Do more people have a chance of getting it? Does it get around faster? And from what you've said, you encountered one case and then you encountered many, many more. So is it more transmissible? How is it different in that aspect, doctor?
I think it's either more than Delta or just as much, but it's definitely not less. It's definitely quite transmissible. Again, so although it is, as I've said, either on par or even more, the clinical symptoms that we are currently seeing is mostly in private practice, 99% mild cases. There might be cases going directly into hospitals. We have seen that some of our hospitals, especially the public sector hospitals, did have an increase in cases, but normally younger people and children. Children is a bit different. The children all have definitely a pharyngitis, a sore throat. That's a dominant complaint, and they can be sick, have a bit of a temperature as well as elevated pulse. But again, they also get better quite quickly. And so for now, we're still waiting. We are waiting for unvaccinated older people with different diseases to be infected so that we can see whether they also get mild or do they get severe. That we haven't yet seen coming into our surgeries.
All right. And so would you say that there has been a large breakout of the Omicron variant in South Africa? And is this something that the country is dealing with effectively? What steps would you recommend maybe for other countries to also ensure that the Omicron variant doesn't latch on to the extent that it can?
So I think it's important to understand that all of us that saw how seriously ill a Delta patient can become. They can get extremely, very, very ill. So we're all afraid that with this 30 mutations this virus got, that the same will happen. But for now, again, it's mild cases. And what do you need to do to prevent the spread of the virus, if that is possible? And I don't really think it's that possible. I think that the virus just carry on because of people not wearing masks, social distancing, that non-pharmaceutical interventions, it's not taking place. Therefore, it's going to be extremely difficult to stop this fast-spreading virus. Luckily, for now, it seems with mild infections. And then vaccines. If you look at what we are seeing, vaccinated people, yes, there's a lot of healthcare workers now who had Johnson & Johnson that get breakthrough infections. The problem is you need to stay 10 days at home, and that might be put as a stress on the healthcare system. But are they very sick? No, mild symptoms. So and that is the whole idea of vaccination. Vaccination for COVID is to say, we need to keep you 94 or 95% out of hospital with severe disease and death. We never said that it will prevent mild infection. And this is actually what we're seeing. We're seeing mild infections, which is currently not difficult to treat, or, they don't need hospitalization, not the mild ones. And as I said, we're still waiting for elderly people, unvaccinated, to come in. They will come, but we haven't really seen an influx of them yet.
Right. So the word mild, I think, is very crucial. You've repeated it a few times. So, and especially in the context of the people who are vaccinated, and that is why vaccinations are so important. One more question I want to ask you on testing, doctor. We are seeing now for genomic sequencing, you said 4 days. From what reports we have heard, it takes at least 72 hours. Someone says 5 days. Do you think that it's possible or at all to have a quicker turnaround time to determine whether or not someone is infected by the Omicron variant?
So again, you can look at it from two ways. If you want to rely on your lab to come up with whether there is a S gene escape or a fallout, yes, you're going to wait at least 24, 48, 3 days. But if you understand the clinical picture and you do a rapid test and you look at the clinical picture and you do your examination, your clinical examination, you will immediately know. And that's experience. Unfortunately, there's not a handbook that you can go and read. It's experience. And those doctors who have seen severely ill COVID-19 Delta variant will understand what I'm talking about. But this is only experience that helps you, and you can immediately say, this is Omicron. This, because they present more or less the same. For us, it's the same. Maybe for other people, we're confusing the symptoms for them. But being a clinician, for me, I'm 33 years a clinician. And for me to say, this is definitely Omicron, it's easy because it's experience.
All right. So experience has a part to play, and like you told us right at the beginning, it was the different symptoms that you spotted that allowed you to think that there is something different going on here. A lot of countries, doctor, apart from vaccinations, obviously, they're imposing fairly widespread travel restrictions and bans. Do you think, I think the idea behind this is that the Omicron variant spread from maybe the African continent, but do you think that it's already present, or was the spotting of it in South Africa fairly new into its being discovered rather, or coming about? Or do you think it's already prevalent in some places?
I think it's all over the world. I think they missed it because of the mild symptoms. Everyone is looking out for Delta type of symptoms, severely ill patients. Therefore, they missed it. And they maybe missed it on the PCR testing as well, regarding the S gene fallout. But now that they know it, it's actually a no-brainer. Once, if you understand what to look for at the PCR, it is easy to detect it. Don't need to go and do genome testing anymore. And again, if you have the luxury of being able to do a PCR with S gene fallout, then it's great. But not all countries have that. Not all places, and not all doctors, and not all towns have that luxury. So you need to understand clinically what to look for. Because in the end of the day, that patient sits in front of you, wants an answer now. Doesn't want to wait 2 or 3 days before you start to decide what type of PCR you send in. And the only thing to do that is to use your clinical skills. We've all been trained as doctors, and it's not difficult. And you need to listen to what your patient said, and you need to have a high index of suspicion to just test. And you can do the rapid testing. It's working. But if you want to do the rapid testing after 5 days, rather go for a PCR.
Okay. And doctor, I have one last question for you. Now, you were the first to raise the alarm over the Omicron variant. A lot of people are concerned about how these mutations happen. Also, doctor, it is not entirely known how the original COVID virus originated as well, where it came about from. Did it appear naturally? Was it created in a lab? What kind of human intervention, if at all, was involved there. Do you think it's still important that we find out and China allow us or any other country allow us to discover exactly how the coronavirus SARS-CoV-2 originated?
I think we will never get that answer. The horse bolted, and I think it would be very nice. It will help if you know, but is it going to change the trajectory of the virus? No. So, it would be nice to have, but it's not going to change anything. What is important is to understand how it mutates, or when it mutates. What is the clinical picture? Can it be traced by the normal PCR and rapid testing? Would it be more transmissible? And then also, one of the questions that we still need to know from now with this one is around the monoclonal antibodies, whether that would work in ICU. We're not sure about that. So that's much more important. It's much more important to understand now, and what are we going to do? And then, as I said, the horse bolted. It's nice to know, but it's not going to change the virus.
Right, the horse is bolted, but it's not important to know because it's not going to change anything. We need to learn more about Omicron. I thank you so much, Dr. Anjali Coetzee, for joining us on Republic and for informing the Indian viewers about how you came about this discovery and how it is different from the prevailing variants. Thank you so much once again.